Welcome back to Inside South Florida. If you're thinking about plastic surgery for health or cosmetic reasons, there are some great new techniques happening right here in South Florida. And here's board-certified plastic surgeon Dr. Jeremy White to tell you all about them. Dr. White, it is awesome to have you on the show. How are you?
I'm doing fantastic. Thank you for having me today.
It's my pleasure. We have some really cool stuff to talk about. And what's so interesting about this is that there are a whole bunch of great technologies available to South Floridians that they can get. One of the places they can get them is from you, right?
That's right. And there are certain things I'd like to share with you guys today that a lot of people are not doing down here. And a lot of the, for instance, the first thing I'm going to talk about with non-surgical ear molding, a lot of the pediatricians don't even know about it. So I'd like to get the word out today and let everyone know that there are certain options even for little babies that can be covered by insurance.
So I know just from talking to you that you're really excited about some of this new ear technology, right? And,
I am.
And how it can help babies and youngsters, and so talk about it.
Okay, so what I've been doing in my practice is non-surgical ear molding, and what that is for babies who are very young, so newborns, in their first couple days to weeks of life. About 15% of children that are born have some kind of ear deformity, and this can range from a large spectrum of things. About 30% of the time, for certain cases, these self-correct, but we don't have no idea which ones are going to self-correct. Sure. So instead of taking the chance of just watching and waiting and allowing these children to be teased in school and be obsessed with their ear deformities up till they're about 5 or 6 years old. Beforehand, there was really the only other option was to wait till they were 5 or 6, and if it meant enough to the child and to the parents, then I would do an otoplasty, which is a surgical procedure. It's outpatient, and it's sort of the ear pinning. Well, I can accomplish a lot of the same things non-surgically as long as they're under 6 weeks of age, and the earlier that I see them, the better. There are better results when I start the process when they're less than 3 weeks old.
Okay.
And if I see them even earlier, within the first 48 hours of life, I can shorten the process.
Again, just because I know you personally and I know how excited you are about this. All right, so a couple minutes left. Let's talk about new devices and techniques for breast augmentation.
Okay, so the latest and greatest in breast augmentation these days, two things. One is the new silicone implants, okay? So silicone implants, in my opinion, they feel much more natural. They have less rippling as well than saline implants. And they're a little bit more expensive, but it's certainly worth it. So the newest things in these implants are, one, the gels are much more cohesive, which means that they maintain their shape more. If you actually cut one of these devices, it used to be that the gel would leak all over the place, and that was a big concern for patients because if they had a rupture of the implant, they would get concerned that, oh, it's going to spread out, it's going to go all over the body, and that actually could be a potential problem. So the newer ones, they don't break as much, and two, the gel is much more stable, and that also allows us to have these new implants, which are the anatomic shapes. So this is the traditional smooth round implant, the silicone, and it's a great device. I'd say still probably about 95% of my patients, they still smooth round gels.
Right.
Okay, and it's a great device. Where this comes in, the anatomic implants, you can see that this has sort of a shape to it, like a teardrop shape. So every woman's built differently. So for certain women who are tall, thin, framed, this may be a more ideal way to get them a more natural teardrop shape. And that's kind of what I pride myself on, is providing natural results. I don't really like the...
well, none of us do. We'll just say that. And then final thing will be the rhinoplasty. Okay. And what advances we have there.
Right, so when you try and reshape the nose, most of the time we're trying to actually make the nose smaller. Well, when we're making the nose smaller, you might not breathe as well. So I pay very close attention to the septum, which is the portion in the midline of the nose, and sometimes that changes the shape of the nose as well, but the curvatures within the septum can oftentimes lead to nasal obstruction or inability to breathe through the nose. One of the newer things that is less invasive, if someone doesn't want to do a surgical procedure, is injectable rhinoplasty. And I think this has its place in plastic surgery, but it's limited. One, the injectables, the only ones that I think are safe at this time to use are the hyaluronic acid compounds. So these are the Restylane, the Juvederm, the Belotero. These are softer. I would not recommend putting it into the tip because the tip, it can cause problems. But if you have small contour deformities, small bumps on the nose, sometimes you can help even that out with just an injection in the office. Sometimes also you find that someone wants to lengthen the nose. Well, that can be done in the office as well with an injection that will help to lengthen the distance from here to here.
Or they could just lie.
They could, which
Right.
is a good option.
Right, there's always that. Thanks so much for coming in. It's always good to see you. And if people want to reach out to you and get some more information about anything that we've talked about, how do they find you?
They call us at Arc Plastic Surgery at 305-501-2000.
Dr. White, my friend, good to see you, buddy.
Thank you so much.
Yep. Thank you, Dr. White. And Dr. White wants to remind you that if you're thinking of getting some plastic surgery done, you should definitely consult a board-certified plastic surgeon. That is going to do it for our show today. Hope you enjoyed it. If you have any ideas, questions, or comments as to what we should cover, you can follow us on Twitter at WSFL. You can get us on Facebook at SFLCW and Inside South Florida. And of course, as always, you can catch us every weekday morning from 6 to 8 a.m. on iOpen. Basically, a whole bunch of different ways to get a hold of us. Have a great rest of your day, and we'll see you soon.